Do you know that even men do have breast cancers? Breast cancer is one of the most common cancers in our world today. Someone can have higher risk of breast cancer if their relative, male or female, have had any type of cancer. Hello amazing people, welcome back to this channel. My name is Jane Ole Okala, and today we're going to be talking about breast cancer. Many people have had people that are affected, many are affected, and some have even lost their loved ones to breast cancer. So let's talk about it today. Let's find out more about it. Let's learn more about breast cancer. If you are just joining us, kindly click on the subscribe button in order to always get my videos whenever I post them. And if you have been on this channel, I do not take you for granted. Thanks for the likes, the comments, and also thank you for sharing. So let's dive right in. It's normal for you as a woman to feel uncomfortable, to be scared. You should notice a strange lump in your breasts. And that is how people usually react when they find a strange lump in the breasts. And that is because of how much they have heard about breast cancer. Breast cancer is one of the most common cancers in our world today. And it is because of most of what I'll be teaching in this video. So stay tuned to the very end in order to get all the information you need to know about breast cancer. Do you know that even men do have breast cancers? So you shouldn't say it's for women, it's for everybody. Even if you do not have breast cancer, you should also learn how to prevent it, because it's a very common illness in our world today. So what really is breast cancer? You can say that breast cancer is a malignant tumor, cyst, or infection in the breast tissue. What are the symptoms of breast cancer? Breast cancer has a whole lot of symptoms, but some symptoms that are most common to women is the lump that appears in the breasts, which could be tender and more pronounced during the menstrual cycle. And it occurs more in women between the ages of 30 and 50. And this is because they tend to have an incidence of higher hormonal fluctuations and imbalances. And at these ages or during these ages, they usually have higher estrogen imbalance, which in turn feeds the cysts, which brings about its multiplication. That takes us to breast lump. There are different types of breast lump. There is the lipoma, which is usually benign. When I say benign, it's not yet cancerous, but it doesn't mean it cannot become cancerous. So lipoma is benign and painless. It's a painless tumor made up of a fatty tissue, but it has the potential to become malignant or cancerous. Another one is fibroadenoma, which is commonly found in women between the ages of 20 years of age and older. It is usually rubbery, firm, and painless, but mostly found in the upper part of the breast. The next one is cystosarcoma. Cystosarcoma, a fast-growing benign tumor. Remember I said benign means it's not yet dangerous. So it's a fast-growing benign tumor that grows in the connective tissues of the breast, but can become malignant or cancerous in rare cases. The fourth type of lump is carcinoma of the breasts. is the type that usually affects one breast, and it involves a dark discharge from the breast. I usually state most of the illnesses in our world today are sometimes caused by the kind of food that was taken very frequently by the victim. What are the dietary considerations? Foods like cola drinks, chocolates, some painkillers, some antacids, and cold remedies should be avoided if breast cancer has been diagnosed. Alcohol should also not be taken, even without being diagnosed of breast cancer. Women that are very addicted to alcohol most times come down with breast cancer. Alcohol has been believed to increase the risk of cancers, and this is sometimes because it raises the estrogen level in the body. Estrogen is a hormone in the body, so it is good to take foods that have high beta carotene, vitamin C, vitamin E. If you're vulnerable to cancer, you might be wondering how you know if you're vulnerable to cancer, but some people usually have it in their genes. That is, it's hereditary sometimes. So if you're the type that has lost a loved one or two or even more to cancer, then you should eat foods that are high in beta carotene, vitamin E, and vitamin C, because it's going to help your body. Let me talk about the risk factors for developing breast cancer. Men, like I said earlier, can develop breast cancer, but women are more likely to develop breast cancer than men. And in women, it's more common in women that are older than in women that are younger, let's say 20 years of age. So some of the factors that influence the development of breast cancer include: 1. Breast conditions. Some breast biopsies sometimes show abnormal cells, and these abnormal cells are usually not cancerous yet, but sometimes do become cancerous over time. And women with such cells usually have 4 to 5 times higher risk of developing breast cancers. Another one is family history. But before I go ahead, if you haven't subscribed yet, please subscribe and also like this video so that more people can see the video and also learn from it. So let's go ahead. Family history. By this I mean having a relative, a very close relative, let's say mother, sister, or daughter with breast cancer, or a male with prostate cancer. The risk is usually higher if mother and sister have breast cancers or have had breast cancers. Someone can have higher risk of breast cancer if their relative, male or female, have had any type of cancer. This increases the risk of developing breast cancer. That is because they have such genes in the family. Such families should be very careful with their diets, with their lifestyle, and many other things that could lead to cancer. Another risk factor is previous breast cancer. By this I mean someone that has developed breast cancer in the past can always come down with another breast cancer if care is not taken. And this is usually because some people tend to go back to the lifestyle that brought about the cancer, or they do not then maintain their bodies in order to prevent the reoccurrence of breast cancer. These people usually have a high risk of developing breast cancer. Also because the cancer might have spread to other parts of the breast and wasn't noticed. Another one is hormonal factors. And people that fall into this category are women that start their menstrual cycle before the age of 12, and those that also have late menopause, about, let's say, the age of 60. We also have the women who had their first pregnancies early in life. These can lead to increase in the level of estrogen exposure. Another set of people that fall under these hormonal factors are those that take birth control pills. Studies have shown that people that take birth control pills usually have small increase in the risk of breast cancers, but this returns back to normal after about 10 years of non-use of these birth control pills. Studies have also shown that long-term use of estrogen and progesterone combined leads to increase in the risk of breast cancer development. But this risk usually comes back to normal after 5 years of non-usage of hormone therapy. Another one is lifestyle factors. Dietary factors and intake of alcohol have been implicated as factors that cause or could lead to increased risk in breast cancer. Others include cigarette smoking, caffeine intake, use of antiperspirants, very tight bras, breast implants, miscarriages, abortions, and even the use of some kind of bras can lead to breast cancer. Breast cancer can actually be prevented with the right diet and the right lifestyle. Most women are very scared of breast cancer. Breast cancer fears can be related to loss of body image, sexuality, surgery, and death. Most times, as in the case of other types of cancer, the cause of breast cancer is not known. But natural remedies offers a whole of promises in the cure and prevention of breast cancer. For majority of women, lifestyle changes, exercise, diet, and weight reduction can help reduce the risk of developing breast cancer. To date, the most important strategy in improving survival of breast cancer is eating natural foods and early detection, which can start from regular breast examination. It's been proven that one or even more than one in every 8 women in the world comes down with breast cancer, and this is because it is ravaging the world and a lot of people do not know how and what to do about it. It is now the most common cancer in women and the second most common cause of cancer deaths in women. Sometimes early detection seems impossible because some women do not even show symptoms. Not everyone shows symptoms until much later. So, regular breast examination is very important. As the cancer grows, symptoms may include breast lump or even lump in the armpit area that is usually hard and has uneven edges. Usually it does not hurt and does not change the size or shape or even the feel of the breast or nipple. For instance, one may have redness, dimpling, or puckering of the skin of the breast like the skin of an orange. Another symptom is fluid coming out from the nipple. This could be bloody, it could be clear to yellow, it could be greenish, or it could look like pus. For men that have breast cancer, they could develop some breast pain and even breast lump. In advanced stages, the symptoms could be bone pain, skin ulcers, weight loss, breast pain or discomfort, swelling of one arm, probably the one next to the affected breast, and so many others. To learn more about how to fight cancers and tumors, you can join my program using the link in this video to join my TubeLast program, where you will be placed on the right diet for your condition and also taught the right lifestyle you need to prevent or cure your body from cancer. It is not just what you eat that causes cancer. Even what you apply on your body, on your hair, and even the kind of air you breathe, the environment you live can cause cancer. So, why not share this video to your family and friends after liking it, in order to get them to also understand that they can also prevent this wide spreading disease with their lifestyle. Thank you for your time. I hope to see you in other videos.